when do you start using this diagnosis? So is there a time frame that you would say that somebody is now having persisting symptoms, or is it something we now think about all the time and kind of change the way that we're even speaking to our patients? I feel like that's kind of the answer, but is there a time frame that you all as a group are thinking to utilize this?
Well, as I said, I think that's a very interesting and spot on question, because we've been discussing that. And I think one of the challenges is that may be a different time point for different patients. So part of that depends on the mechanism of injury. If it was an injury sustained from a chest-to-chest impact during a pickup basketball game, that trajectory could be very different than somebody who is in a high-speed motor vehicle collision, or a football player who's had multiple concussions. And so I don't know that there really is any cookie cutter answer to that. I think it's when you look at this patient and you're starting to think, gosh, they're not getting, well, first of all, if they're not getting better at all, we know after concussion, people get better. So if they're not getting better or they're getting worse, we know what the recovery curve of concussion looks like, and it goes like this. And if it starts to go like that, there's another factor, something is going on. So I think looking at the recovery trajectory, and I think for that individual patient, if it's a low speed, relatively uncomplicated first concussion, they typically are going to start getting better if it's an adult within a couple of weeks. And if they're 6 months out and still saying, well, that's a problem, and then of course there's a big gap in there. I think one of the most important issues is to really try proactively to prevent persisting symptoms, which is education immediately. And sometimes that's correcting misinformation, because sometimes people come out of the emergency department with horrific information. You just had a horrible head trauma. You shouldn't do anything at all for 2 weeks, and now you may have increased your risk for CTE. Those things are in medical records. And so it's really important to provide corrective information and re-education, and sometimes directly address misinformation that the patient has been given. So I think all of that, individual recovery, and then proactive education and trying to prevent those persisting symptoms.